It is 11:03 and back at it. Dr. Payne Show. Phone lines are open. You have questions, comments about your health, maybe calling for a friend or a family member. That's cool too. 416-870-6400 star 640 on cell. How many people have come into your clinic after shoveling that first snowfall? Oh, I'm done. I'm done. Right?
It wasn't that bad.
No.
It wasn't that bad. But
I don't shovel till December. I don't care how much snow we get. I'm not doing it. I refuse. Really? November? No, I'm not shoveling. It's not happening. Slip, fall, whatever you're going to do. December, then I'll start shoveling.
You'll start. Okay, so there we go. Don't apply that logic.
That's right.
No, you know what? A lot of the times with the shoveling the snow, I mean, obviously everybody thinks you're shoveling the snow and all of a sudden, in an instant, something happens and you're toast. A lot of times it's more of a cumulative effect, and days later you'll start to feel it. And I would say that that's the vast majority of cases. It's not necessarily I remember that exact point I was shoveling, I felt something and boom, I couldn't move. It's usually I shoveled the driveway, everything seemed fine. My back was a little sore that night.
Right.
Went to sleep, got up the next day, felt a little bit worse. And then, you're talking 24 to 48 hours, all of a sudden it's like, now I can't move.
Now I'm not getting up.
Right? And so it's more of like that cumulative effect and
right.
the muscular injury, and that's sort of similar to a delayed onset muscle soreness that you see with working out, right?
Sure.
So it's a similar thing versus that instance, like if you're picking something up and all of a sudden it goes and you're not moving, that's likely something like a disc herniation. So I would say the vast majority of cases are the first scenario where it gets a little bit worse a few days in, and the good news is those are usually much easier to treat too, because muscular injuries are going to be definitely more easy to have treated than something like a disc bulge or disc herniation that's putting pressure on the nerve. But I mean, and here's the other thing too. A lot of the times it can seem like it's just a muscular issue, but it's really a disc herniation, which again goes back to my point consistently of dealing with things early on.
Yes.
If you feel something, get it checked out. Every time I see an acute low back pain case, I always have in the back of my mind that this could be a disc issue, because it's usually the thing that's most severe out of the mechanical issues that can happen in the back. And a lot of times in the beginning, it could simply present as a muscle or something more simple, but yet it's actually worse. So it's very, very important to keep in the back of your mind that, yes, this could be a disc issue. And if it is, again, those are things that need to be taken. All injuries need to be taken seriously, but a disc injury, like a disc bulge, disc herniation, putting pressure on a nerve, that's no joke. And anybody that's had that knows that it's very, very serious stuff. And then, if you get neurological involvement and it starts to really put pressure on the nerve, and now all of a sudden you're losing muscular control or sensation and things like that, that's bad news bears.
416-870-6400 star 640 on cell. What else is going on with you the last week or so we should know about?
Well, this time of the year, we were talking before, vaccinations, the flu shot, right? Yeah. So that's a big thing. And I often will get asked, is it something that people should or should not be doing? I'm definitely a proponent for vaccinations in general. I think that it's done incredible things for society. In terms of the flu shot, I mean, there's it's sort of split there, because it doesn't necessarily protect against all strains.
Case by case, right?
Yeah, it's case by case. And I mean, there's definitely some vulnerable populations, like the very young, the very elderly, the sick. Yeah, absolutely. Like, even if it's not going to be 100% perfect, why not do something that protects you maybe 50%, gives you a 50% chance of being protected? And I mean, so here's a good example that I use where someone says, yeah, but I'm healthy and I don't need it. So the example is my mom, for example, has COPD, which is chronic obstructive pulmonary disease. And something like the flu to my mom could potentially be disastrous, right? So she absolutely gets the flu shot. Now, I might sit here and say, well, I'm only 33, so I'm not going to get it. But it's not about me getting sick. Yeah, I'll likely be okay. But what if I get it and somehow I give it to my mom, right? So why not... And I think that's another important thing to consider is who are the people around you that are potentially these vulnerable populations. Right. It's not just, are you the vulnerable population, but what if you're working with the elderly, right? Like people, so I think it's...
Or in a daycare. Those people generally get it, but yeah.
Yeah, exactly. But I think it's very, very important. And most people are not isolated where they're just with themselves. So I would say, overall, the vaccination, getting protected against the flu is very, very important. And if people often think like the regular cold that they get is the flu. That's not the flu. if you've ever had the flu, you're incredibly sick.
Yeah, you know.
Even someone who's young and healthy, you're sick. This isn't, oh, my throat's a little sore and my nose is running. No. That's like the common cold. The flu is no joke, and it kills a lot of people. Again, especially in those vulnerable populations. So I think it's important that people do get vaccinated.
Hey, Bill. Good morning. How are you, pal?
I'm good. How are you?
Good. What's your concern? Welcome to the show.
Well, thanks for taking my call.
Sure.
My concern is I'm dealing with urethral strictures.
Sorry?
A stricture in my urethra.
Okay.
So I had HIFU for prostate cancer 9 years ago.
Mm-hmm.
And I had strictures related from that. Everything was good. And then the cancer came back about a year ago. So I've just gone through radiation, 20 bouts of radiation over a 4-week period. And now the strictures are back, so I've had to go to the hospital. I've had it dilated, and now I'm self-cathetering.
Okay.
But I'd like to get it sort of really fixed. Now, the issue right now, which I can't understand, is even though I get up numerous times during the night, which I've dealt with that for years, and it's not an issue, I have no problem urinating. Then, once I'm awake, brush my teeth, then I can't. Then I've got a catheter. And catheter, like, I can, get little bits out during the day, but I end up having the catheter like 3 or 4 times a day.
So what's the question, Bill?
Question is, how can I get rid of a stricture for good?
Wrong person to be asking. This is definitely not my area of expertise. You need to be seeing a urologist.
Which I have, yeah.
Yeah, and so, I'm, we're mainly dealing with the musculoskeletal injuries, and this is not something I've ever dealt with. So I'm not the right person to deal with that. But I would say for sure, a urologist, of course, is the right person to deal with that. So, and here's another thing: if you don't like the opinion of one urologist or you don't necessarily agree, you can always get a second one. And I think sometimes that's important with a lot of things. It's important to maybe have a few opinions on how you deal with something.
Billy, appreciate your phone call and time for you as well. 416-870-6400 *640 on cell. You want to email Dr. Lou anytime as well, info@paincarecanada.com. Just getting warmed up here. Lots more on the way. Dr. Payne Show, Global News Radio, 640 Toronto. And 11:13 Saturday morning, Dr. Payne Show, 416-870-6400 *640 on cell. You got questions about your health, bring them on. Maybe calling for the benefit of a friend or family member. That's cool too. We'll take them right before, up to around 12 o'clock today. Yeah, flu shots, one thing. Vaccinations, another thing. We were talking off air during the break about people that are believe, or at least they're hardcore non-believers in vaccinations. And, you kind of made the good point. Yeah, I get it on an individual basis or maybe for your kid, but look at the grand, like polio, fun disease. You want that coming back? I
mean, I think it's crazy the way we're moving towards that where and again, I don't want to be critical of people's choices, but I just think you need to understand the bigger picture here of what public health has done with vaccinations. Like, we've eradicated diseases because of vaccinations. And now to think that, and the research is very much doesn't support that there's anything negative for it. When you look at a lot of the research, even a one groundbreaking study that did have a link was found to be very, very flawed. And the study was actually retracted. So overall, the science doesn't prove that there's anything negative with a vaccination. And I think it's a very dangerous thing that more and more people, as time goes on, we're moving towards this anti-vaccination thing. It's potentially a very dangerous thing, in my opinion, and based on what I've seen on the research. So, I mean, that's a heavy topic. It's
sure,
a lot of people have their personal preferences, and I think it's a debate that needs to be had. But that is my view on that. So, it's a slippery slope.
It is. We'll get to Ed. Hey, Ed. Good morning.
Hello. How are you guys?
Good, sir. What's going on with you?
Well, just over a year ago, I slipped on some ice coming out of work there, and the arms went back in the air to steady myself, and I pulled something in my arm, a muscle there, by my bicep, and now even to this day, they've done ultrasounds and said no, it was a pulled muscle, that was it. But whenever I do anything, like I went a few months ago to throw a ball for a dog, and as soon as my arm went over my head and forward in the throwing motion, my bicep just felt like someone was sticking pins in it there, and tears came to my eyes. It was that painful, and every time I do that, I've tried it a couple times.
What treatment have you done for it, Ed?
I've done a little bit of massage there. I went to a guy who did like a little red laser dot thing there and stuff. And
so how much therapy?
Not a lot, because I don't have any insurance or anything there. So
yeah, so definitely with a physical injury like that, you need to be doing rehabilitation, and a lot of it should be exercise-based things that you're doing every day to strengthen that area. Like these injuries don't just heal on their own. And yeah, I get the point about the lack of coverage and whatnot, but unfortunately, that's the reality of our system. But if you need that, then there's really no better option. That you need to get therapy and you need to rehabilitate that area. Otherwise, it's just going to be like that. And then if it's like that for a long period of time, it will just become a chronic issue. And things will only get worse, in all honesty. Like I make no bones about it. I'm not trying to be harsh about it, but the reality is that these physical problems that need physical intervention, and your story is unfortunately not unique. I hear it a lot where people say, yeah, I had this type of physical injury. This happened and I haven't done anything for it. And it's like, well, you need to do something for it, or otherwise it's going to, this is one thing when you're 20 and you have that type of thing, maybe it heals, or the wrong way to look at it is oftentimes when you're young, the pain goes away, but it doesn't necessarily mean that it heals properly. And a lot of those injuries actually come back to bite you in the butt later on. But, as you get older and these things happen, they are less likely to go away on their own for sure. And so, yeah, you likely need therapy. I mean, if there's nothing more serious there that's surgical in nature or anything like that, you need the therapy. And even, here's another thing with people, even a lot of times when you do need surgery, you still need therapy. Yeah. Right? I had a patient this week that has inflammation in their wrist. It's called de Quervain's tenosynovitis.
Wow.
And yeah,
that needs an acronym big time.
So anyways, but they've got inflammation and they do tiling, and they want to now go and get surgery. And my first recommendation was take time off from work, because if you don't stop, then the inflammation isn't going to go away. But they don't want to take time off work. And now they want surgery. It's like, well, don't you think you're going to have to take time off with surgery?
Yeah,
like
maybe more.
Yeah. Well, or maybe potentially less. But I would say, why not just try it first? So yeah, Ed, sorry, not to go on too much of a tangent here, but you need a little bit of therapy and you need some rehab in that arm. And that will likely help you significantly. And if you don't do that, unfortunately, there's not going to be a heck of a lot of other things.
All right. Perfect.
Okay.
Thanks, Eddie. Appreciate your call. You want to call in, you have time, 416-870-6400, star 640 on cell. It's amazing. I'm guilty of it as well. When it comes to taking care of your body and other things in life, there is priorities. We'll talk about that here in just a bit. Brian, I see you there as well, and lots of room for your phone calls. We'll get right back at it. Dr. Payne Show, Global News Radio, 640 Toronto. It is 11:21 and 416-870-6400, star 640 on cell to ask your questions and comments till 12 o'clock. Hey, Brian, good morning.
Good morning, gentlemen. How are you?
Good. What's up?
I just wanted to make a comment on the fellow that phoned in a few minutes ago about when he was doing the throwing up motion and really had a lot of pain from that.
Yeah.
Just to go back a little bit, when I was in my younger years, I played a lot of baseball, and I obviously had to throw the ball a lot. And what I did was I sustained an injury, which at that point was fairly minor, but I never got it looked at. And here I am, 71 years of age, and 2 years ago I take up tennis. And, of course, the first thing I do is when I go to serve a tennis ball over, same thing, my arm
shoulder,
over my head. So anyway, make a long story short, I go, and apparently I had been living for the better part of 35, 40 years with a torn rotator cuff.
No kidding.
There you are. So, I mean, you're highlighting exactly what I'm saying is a lot of times when you're young, these things, the pain may go away, or if you don't do that activity as much anymore, but these things don't just heal on their own.
No, they don't. And so I thought it was a good example for that, that happened, similar kind of thing happened to me too. And, so anyway, I ended up going and getting, I would encourage that gentleman to get himself an ultrasound. And,
he mentioned he already had one.
Yeah. I mean, I'm no doctor, but you're obviously the professional, but I would bet you dollars to donuts that fellow's got something wrong with his rotator cuff.
Yeah, I mean, potentially. Now, the other thing is a lot of rotator cuff tears are unfortunately the reality of just degeneration. They just tend to happen as your body gets older. So, I mean, the most important thing when it comes to these types of injuries, and I mean, we've had shoulder surgeons on the show, it really comes down to a professional who knows that area of the body and the physical exam that they do. And if you do the right physical exam, then the ultrasounds, the MRIs are really just to confirm what you already know. It's just to put the check mark beside the box saying, yeah, we've confirmed this on imaging. But a lot of these things we can tell just based on the physical exam. But I mean, thank you very much for your call. It very much highlights exactly the point that I consistently make on this show, that if you don't get these things dealt with, they don't just
fester.
Yeah, one day they will come back.
Yeah, that's the way it goes. Got hey, Chelsea. Good morning.
Hi. Good morning.
How are you? What's going on with you?
Hi. So I'm 24 years old from Toronto. I had scoliosis surgery when I was about 16. I have 2 rods and about 32 screws in my back.
Yep.
And I was also diagnosed with osteomyelitis of the spine shortly after. So I had to have all that taken care of. And I'm still living with pain almost every single day. I do work in healthcare as well. So I'm on my feet working for 8 to 10 hours a day.
Yep.
And I exercise regularly. I've tried yoga. I do massage therapy. I've done physio. I swim. And I'm not interested in taking any medication, but I'm still living with pain. I can't sit for too long. I can't stand for too long. I can't sleep in the same position for too long. And I just don't know what to do anymore.
Right. So let's start with, so how bad was your scoliosis? How many degrees when you had the surgery?
I had 3 different curvatures.
Yeah.
The biggest, I believe, was 58 degrees.
Wow. Yeah. So, I mean, a lot of people have a scoliosis. Like, for example, I have a scoliosis of about 20 degrees. But you, in your case, is very different because, number one, a scoliosis is very, very important during development, so up until 21 years old, which is why they tracked it in you. Anything greater than 30 degrees is usually surgical, and then having multiple curves is obviously another indication. So they'll go in, as they did with you, put in Harrington rods to straighten the spine out, because that would likely just get worse over your life. Now, the reality is, though, it makes sense why you would have back pain, right? Like, you have a lot of hardware in there. After those surgeries, a lot of the muscles weaken as well. So, it sounds like you've done a lot of things in terms of the therapy and those things. And those things are great for exacerbations, but you're sort of in the same boat as just the general person with low back pain. You got to get your muscles strong. And those are not, like, yoga and those things are great, but they don't specifically rehabilitate the right muscles. Or in the right progression or in the right series that it should happen. So you need to start with someone from scratch, start the baseline rehabilitation that progresses every 2 to 3 weeks until the point that you can do a lot of these things on your own. And even that is not going to make you 100% pain-free, because the reality is you have a significant problem in your back. But in strengthening your spine and the core and all of the things that surround the spine, what you will be able to do is definitely minimize the pain, mitigate the chance of exacerbations, and just be able to live with it, and also slow down the progression of that pain going forward. So that usually is my recommendation for someone like you, is that you really need to get on the right track for the rehabilitation component and doing these exercises, daily, sometimes 2 to 3 times a day. And then, the other thing with someone who's had the significant trauma to the spine like you, because of the scoliosis and the surgery, is your spine is likely to degenerate quicker than someone else's. And so again, having strong muscles is very, very important towards keeping the pain levels down. So I think you should come see me. I think we should assess it and then make a game plan on who you should see for the right exercises. And the therapy, like the massage, the physio, all that stuff, that's all great. But again, that I think should be reserved for periods of exacerbation. And really, we need to work on how do we get your muscles in that area strong again to keep the spine stable. And the research is pretty clear that when we can stabilize the spine in that sense, pain levels do go down.
Okay, thank you so much.
No problem.
Awesome. Thank you.
Yeah.
Thanks, Chelsea. Follow up one. Pardon me. 1-855-DRLOU, Dr. Lou.
I'm not going to save you.
No. Thanks, man. Appreciate that. Good doctor. info@paincarecanada.com through email. Your phone calls as well, 416-870-6400, star 640 on cell. Still got lots of time. Dr. Payne Show, Global News Radio 640 Toronto. It is 11:30. Dr. Payne Show, 416-870-6400, star 640 on your cell. Yeah, talking about following up when you get problems and symptoms. You know, it's funny, and I'm guilty of it as well. I told you today, this problem in my elbow's back. It's been gone away. Turn your mic on, you monkey.
There it is.
It goes away for
I
6
figured
months.
what this thing was like.
The on-off button?
Yeah, only a few months ago.
Wow.
I was like, oh, that's what that is, because it's usually done. You get
served.
Yeah,
it's done for me. Wow.
And one day I was like, I wonder what this thing's for. And I'm playing with it.
Turns your mic on and off.
Can you hear me now? On.
Yeah.
On.
Off. It's amazing. It's like preschool. So, yeah, taking care of your problems when they arise. I mean, I'm guilty. I got this elbow that keeps coming back. Have I gone to you for it? No. But when people go home today and they find out their cable is out, no.
Yeah.
They're making that phone call.
Oh, yeah, 100%. Right? Yeah. I mean,
it's weird how we work.
Yeah, I mean, that's psychology. Yeah. Different show. We got to do a whole one on that one. But, yeah, I mean, hey, I'm guilty of it myself.
Yeah.
I've put a lot of my own injuries on the back burner as well. So I think that's human nature. But I mean, the reality is I have to be an advocate for this, because if you don't tackle it the right way, then these things get worse. And I mean, the research is pretty clear on a lot of this stuff. It's not rocket science. I consistently usually say the same message. It's really about getting early intervention. And then the intervention, a lot of it has to be exercise based. Right? Like what I just told Chelsea, a lot of it is just how do you get that area of the body back to being strong on its own. And that's, unfortunately I'm giving away all my secrets here, but that's really the two big things, early intervention for these musculoskeletal injuries, and then long-term exercise rehabilitation is usually the answer. And if you can do those two things, oftentimes these things you're going to get them better. And I mean, the best research that we have on a lot of different types of injuries, and this is pretty consistent whether we're talking about the hip, the knee, the back, the neck. If you do this type of stuff, it's going to work. And exercise is a big part of it, the exercise rehabilitation. And now, a lot of people can walk you through exercise rehabilitation. It's just about going to the right place to do it. And really, I would say that's where we specialize, is we make sure that people are doing that right exercise rehabilitation. Everyone I see, I'm telling them the things that they should be doing on their own. There might also be, the example of the person I was talking about with the wrist issue, the De Quervain's tenosynovitis. Same thing. You're telling someone to take some time off to do things, and a lot of times people, they don't understand. The reality is, if you don't do it now, if you don't take the time now, you're gonna have to take the time somewhere. If you do surgery, you're not going back to work the next day. You're going to have to take time off. You're still going to have to do the rehabilitation.
Right.
I mean, there's very good evidence to suggest that if you do some type of surgery and then don't do the exercise, the rehabilitation following the surgery, your outcomes are not good. You have to do that stuff. So it's usually a part of the game plan. Anyways, and again, I'm just trying to hammer home the same message consistently week to week, that it's early intervention. A lot of it is exercise based, and people want a quick fix for it. They want someone to do something to them, or a pill or something that will get rid of these things. But the reality is that's not the way it works. That's not the way it works. And I mean, if I ever develop something different, I'll let everybody know. But I also tell people I don't have any magic cures. I'm not selling anything here that's come see me. And, a lot of this is just simply management.
Yep.
And that's the reality of it.
Well, I mean, speaking from a personal standpoint, my sister-in-law, I think we'll have her on next week, because she's got the grandson right now, so she's up to her waist in kids. But I might have her on the show next weekend, because she came to you, and I told her to go see you because she had back problems. I can't remember what her diagnosis was with you, but she got treated, went for a few treatments with physio.
Yep.
Been given exercises by your team, and every time I see her, I break her hump. You doing them? She goes, yep, every night religiously. Yep, do them every day. How's your back? Almost 100%.
Yep,
almost 100%.
Yeah, I remember when I saw, and I'm assuming she'll be okay with me saying this, but when I saw her, I told her, you got to, the passive therapies, the medication, very, very important in the beginning. But at this stage now, you got to be doing exercises. And here's the thing, if she stops doing them, and it's not unlikely that her pain's going to come back. A lot of times this is part of your life now, right? If you're diagnosed with diabetes, and it's a consistent analogy that I use, and you're told to take some type of medication for it, like metformin, that's not like I'm going to take it for 3 weeks, get my blood sugar under control, and then stop. No, unfortunately, you now have diabetes. This is a management issue. Low back pain is the same. We were just talking that, the stat is about 80% of the population will experience back pain at some point in their life. And the research is pretty clear that once you've experienced it once, and I mean, we probably have a ton of people listening that can vouch for this. If you felt low back pain once in your life, you've probably felt it a second time. You've probably felt it a third time, or it's probably always a little bit there. And that's just the reality of spine-related pain. That's the way it works, unfortunately. And so, that's why the answer is often doing the right exercises to strengthen the back and the core. And this isn't just, and I'll often refer to research. The research is also pretty clear that this isn't like, oh, here's a form with 5 exercises that I want you to do. It needs to be graded rehabilitation. There needs to be something that prevents adaptation, that continually makes it harder and harder. And then you go and do these things on your own. That's it.
416-870-6400, star 640 on cell. Any of this ring true for you? Feel free to give us a call and talk about it. And you never guarantee pain-free. That's not the point of this.
Never, ever am I guaranteeing pain-free for anybody. That's not. And you know what? Anybody that's suffering with any type of pain is usually not looking for pain-free. They're just looking to be better.
Looking to live.
Yeah, they're looking to be better. Like, I think we all have some low-level pain at certain points. No. There's no guarantee here of pain-free. Absolutely not.
Yeah. We'll take a short break. Got time for you and your phone calls. We got open lines, 416-870-6400, star 640 on cell. info@paincarecanada.com. You'll want to reach out and contact Dr. Lou, and 1-855-55-Dr. Lou, DRLOU. We'll get it happening for you. It's 11:37, more Dr. Payne right up till noon. Global News Radio, 640 Toronto. It is almost 11:40, still plenty of time for you to call in, ask your questions. This is the show to do it, 416-870-6400, star 640 on cell. John, thanks for hanging in. How are you?
Good, how are you?
Good, sir. What's going on with you today, or in general?
In general, quite a bit, actually. I was listening to what you guys were talking about the pain management and with the back and so forth. I'm 45 years old. When I was 11 to 12 that year, I grew 11 inches, so scoliosis became an issue. Recently, I had an MRI done, and they found 12 angular tears down my spine from my neck to my tailbone.
Yep.
I'm in the construction field, so I'm constantly using my shoulders and so forth and getting pain in my shoulders and my neck and right down my back. They prescribed me medications for pain, the opioids and all that, which I've gotten off of and don't want any pain, but I like the idea of the exercises that you were talking about, just to see if you have any thoughts of what are good temporary until I can come in and see and see what I can do.
Well, yeah, and so this is a question I get a lot as well with are there general exercises? So I'm often hesitant because it very much depends on the person, right? Like, not depending on previous injuries, what the exact issue is. Not all exercises are good for everything. In general, however, there's a biomechanist out of Waterloo. His name's Stu McGill, Dr. Stu McGill, has what he calls the big 3 exercises, and you can look those up. Everyone can look those up. And it's a combination of planking, on a general plank, side planks, and then a modified crunch. There's not a sit-up, but a modified crunch. Right. Those, and then what's called a bird dog, which is very, very hard to explain.
I know what a bird dog is. Yeah.
That combination of exercise seems to be very, very good for almost any type of back pain, because it doesn't. You're never really putting someone. So the problem being a lot of things, like I'll get a lot of people that say, well, I do yoga and it's not feeling better. But it's like, well, you potentially have a disc herniation and you're putting your body in flexion, or you have stenosis and you're putting your body in extension. The nice thing about those exercises is very much there's a lack of movement versus it's just mainly about strengthening and planking. So anyways, going back to planking. Planking seems to be pretty good for almost any type of back pain. Now here's the issue. It's never just the exercise, it's the progression of the exercise that's the most important. well, I shouldn't say the most important, but equally important. It's the progression and how you modify for, I'm not going to give a plank to an 85-year-old woman the same as I would to a 45-year-old man, for example. And so that needs to be modified. But in general, getting the core strong is the goal. And again, those exercises are sort of a good general place for anybody to start.
Oh, perfect.
Okay.
What are your thoughts on the resistance bands?
For core exercises?
For core, even in the shoulder and stuff like that,
and again, this is where progression is what matters. So and I'll give you some simple rehabilitation classes right now in terms of teaching people. Your muscles work in a couple different ways. So we have what's called isometric, concentric, and eccentric. So isometric is when you can activate a muscle without actually moving it through its range. So a good example of that is like if you have your arm stretched out and we're dealing with the bicep and you press it against the bottom of a table and you're pushing up, my bicep is not moving, but I'm activating it. That's called an isometric contraction. So there's an activation of the muscle, but there's no movement of it. Versus if I then take a dumbbell and my arm is straight and I lift it up, that's concentric. So I'm shortening the muscle. Versus eccentric. Now I'm at the top, I put the weight there, and I lengthen the muscle slowly. And I'm telling you those in progression of easiest to hardest. So isometric, concentric, and then eccentric loading of a muscle is the progression from easiest to hardest. So a lot of times a bend can often be concentric or eccentric because it requires you to move. If you don't know how to activate a muscle without moving at the isometric, there's no point in going to a bend, a concentric or eccentric load. And this might be getting very complicated with me just, rhyming it off on the radio like this. But my point being is that you have to be able to activate a muscle properly without moving it through its range first. So are bands good? Yes, but at a certain point after you know how to activate it with a lack of movement first.
Makes sense.
Yeah.
Okay. Awesome. That's
no
great.
Problem.
Thanks, John. Appreciate that. I want to follow up 1-855-55 Dr. Lou, DRLOU. This is why. Well, that's why right there. Perfect example. You need to just don't wing it. Don't look at someone in the gym and say, I'll try that.
And that's why I'm often hesitant, like to just say, oh yeah, do this. Right. Here's slap this on everybody and everybody do this, because it often doesn't work, right? Because people have modifications. Like you might have the same disc herniation as another person. I can give you an exercise, but you might also have a shoulder tear, and so I don't want you putting pressure on your shoulders. Right. So it's a tough one to give in that sense. I have an email here. It says, "Hi, Dr. Lou. Can you help to eliminate pain due to rotator cuff injury?" Again, it's a hard question because it depends what the injury is, general. Right? Like if it's a complete tear, then you often need surgery, which yes, we can help with. We can facilitate a surgeon to see you. A lot of times it's just simply strengthening that's required. In general, I mean, it always works the same way. It starts with an assessment. We need to figure out what is causing the issue. Once we determine what's causing the issue, then we have our options for treatment. Treatment is often, when you're, that's a break that's coming. So we'll get to the treatment after. Finish
up what you're talking about.
Oh, yeah.
You're a rebel. Be a rebel, man.
It's going to be, how long do we got?
Yeah, you got a minute. Do what you want.
Okay. So, when you're looking at musculoskeletal injuries like this, there's often, here are the options. You have medicine, you have injections, you have surgery, you have therapy, you have bracing, and then you have, diet and things like that. You should be trying the least invasive options first, moving towards most invasive. Gotcha. And a lot of times the things that seem to be more prominent, like the injections, things like that, don't have good research.
Right. Now we'll take a short break. 416-870-6400 star 640 on sale. You still got time. Call in if you have questions you want answered, something physical or otherwise. For you, friend, pal, family member, bring it on. Dr. Payne Show, Global News Radio, 640 Toronto. It is 11:49. Still some time for you to call in and ask your questions. Dr. Lou is here. Tell me a little bit about the consultation, the follow-up. How do we go about doing that?
Sorry, I was reading an email. Maybe I should wake up. What'd you say?
Just pay attention to
Hey, Johnny.
What are you, my wife?
I'm a little bit sick, so that's the other problem.
Thanks for telling me now in this hermetically sealed studio, breathing each other's CO2.
We're not on the same mic.
We're close enough.
Yeah, we're close. That's true. Sorry, the question was?
The consultation, the initial meeting.
The consultation is very, very simple. You give me a call, and we'll set up, or send me an email, and we're going to set up a time to have a quick conversation. And then an assessment happens in office with me. It's a one-time visit with me, often maybe sometimes a second visit if we have to get some imaging or something done and we need to review it. And then once we have those answers, then I often send people off to somebody in my team.
Okay.
And again, that very much, it's very hard. People often say, well, who am I going to see after? It depends. Right? If I'm suggesting that you should be getting, for example, therapy, you might be seeing one of the physios, one of the chiros. If you need surgery, you're obviously going to be seeing a surgeon. So it very, very much depends. And here's a question that I have. I have an email here. Hi there. I've been listening to your show on 640. Quick question. My friend has a 5-centimeter tear in her rotator cuff. She's been seen by a doctor. She's very afraid to get surgery. Any ideas? Need to assess it. It's very, very hard to say. I mean, there are some things that require surgery, and that's the best option.
Is that a big tear? That sounds like a big tear. 5 centimeters.
Yeah, that seems significant.
Yeah.
I mean, what's also important is assessing physically what's going on. Is there weakness? Does she not have, and then those types of things. So it's these, and these are consistently the types of emails that I get. A lot of times my answer is I need to see it. And then that should make very good sense to everybody. It's very hard for me to say without seeing somebody what should or should not be done. So this is from Gary. So, Gary, if you're listening, have your friend give me a call and let's set up an assessment.
Gary, that's 1-855-55 Lou, DRLOU, or info@paincarecanada.com. Yeah, it's like the equivalent of, my car's going, what is it? Yeah, you got to come bring it in.
Yeah, it's difficult. And I mean, sometimes it's good though that we start with emails or phone calls, because there's been a lot of times where I speak with someone. It's like, hey, you're doing the right things already, and so I might be able to speak to this person. They might give me a little bit more information, and I'll just simply say, yeah, that surgeon that you're seeing is probably a good idea. But it all starts with a simple call, and we're gonna have a conversation that's totally free, and we go from there.
Awesome, Sammy. Good morning. Thanks for hanging in. How are you?
Yeah, good morning. Dr. Lou.
Yes, sir.
My son is 34 years old. He blew his knee, ACL.
Yep.
He's having the operation on Friday at Women's College.
Okay.
He's having one operation and he's having another one operation. Why can the doctor do the same knee at the same time?
You got to ask that doctor. Hard for me to say. Yeah.
The reason was why that he told us he doesn't have the room, the surgery room.
Okay.
He only's got it for an hour.
Right. Okay. Well, then that's his reason why he's doing it.
Yeah.
Yep.
Because I was surprised. I thought they would do the both things at the same time.
Again, my answer to that is you got to ask him, and it sounds like you already have the answer. He's only got 1 hour in the operating room and could do that. That seems like it's the answer.
Yeah. Okay, Doctor.
Yep.
Thank
No
you
problem.
For your time.
Thanks, Sammy. Appreciate that. I can understand the frustration, but it's the reality of it, right?
Yeah. I mean, I get the frustration, but he already had the answer.
Yeah.
And that is a reality of operating rooms, right? They do go based on booking, based on hours that are available, and multiple surgeons are using it. So sometimes if it's really a matter of, is there time in the operating room? And so that's a fair reason, right? Like that's maybe not ideal for sure. I think I agree with Sammy on that point. It doesn't seem to be ideal, but it's unfortunately the reality. And so those are questions for the attending physician.
How's the knee clinic? We've had Dr. Bragava, Dr. Gordon on here. Those guys are both excellent talking about the injections and stuff like that.
You know what? It's been great, and we've sort of expanded as well into shoulders.
Excellent.
Because Dr. Bragava also is a shoulder specialist. I mean, we're able to see someone. People are coming in to see me, and then on that same visit, they're seeing Dr. Bragava if need be. And that's proper management. And then, so here's an example. Someone came to see me, had a bicep tear. Happened, I think it was on a Tuesday. They saw me on a Thursday. They saw Dr. Bragava on that same day. By next Tuesday, they were already having that surgically repaired.
Wow.
That's
nice.
plan of management. That's how it happens. They're already in physio, and they're already getting better. That's the way this should happen.
That's like living in America. That's like
Are you saying
like
I'm
American
Donald Trump?
There.
Is that
No. You have much better hair, trust me. We got to Mitch. Hey, Mitch, good morning.
Hi, good morning. How are you?
Good, sir. What's going on with you?
Well, I've had a fairly long-term, when I say long, maybe 8, 9, 10 years. It's not on my spine. It's left of my spine, above my gluteus.
Yep.
And it nags. Mostly I find when I'm just standing still, if I go, for argument's sake, to an art gallery and you're standing for long periods of time. If I'm walking, I'm cycling, I'm fairly active, I travel a lot, doesn't bother me so much. But if I have to stand around, and I did this morning in line at a store, my that area it's very sore, and I've only tried a very, very deep tissue massage. It's called Twina, and he works the area fairly extensively and very deep, and it's rather painful. And it gives me some relief, but it hasn't gone away. And I just wonder what else I could or should be doing.
You should be getting it assessed.
Yeah.
Is the first thing that I would say. You're telling me that you have it's still in the low back. I know what you're talking about. It's the sacroiliac joint right above the glute. You have pain there. The question becomes, well, what is causing that pain? And there's a multitude of different things that could be causing that pain. And the only way to know is to have someone who's, a proficient at assessing these types of things. Now, that could be your family doctor. It could be a therapist that but someone needs to assess it and give you an answer as to, okay, what is the diagnosis? Once you have the diagnosis or a clinical impression at the very least, then you treat it based on that. But there's a whole bunch of different things that could cause that type of presentation. So, that's what you got to do. You got to get it assessed. I'm happy to do that for you if you like. Or like I said, you could see your family doctor. But, again, these are specialized areas of the body that I often think need specialized knowledge. So, I'm biased, and I'll say that I think that I should be the one doing it or somebody in my team at the very least.
Right. So I've been to my family doctor. He said nothing really shows up in an X-ray.
Yeah.
He
Common.
thought maybe it could be arthritic.
Well, that would show up on an X-ray.
Oh, then he said nothing showed up on an X-ray.
Yeah. So, and a lot of times they don't. An X-ray is very, very good to make sure that there's no serious problem in the bone, essentially is what you're doing, or that there's no fracture or anything like that. But a lot of times these things are soft tissue related, and that's not going to show up on an X-ray. In fact, a lot of times they don't even show up on imaging for soft tissue things. So what it really comes down to is, again, physical assessment, functional medicine, someone who understands the body, puts different strains on that area, and can figure out, okay, here's the structure that's likely causing that. Once we isolate the structure, then we provide the treatment to that structure.
Okay.
Okay?
So, I'd like to follow up with that.
Sure.
What do you suggest? Call the clinic, I guess.
Yeah, give me a call and leave me a voicemail. I'll give you a call on Monday or Tuesday, and we'll have a quick. Well, I already know what your issue is, so I'll probably just send it off to my team and get them to give you a call.
That's how it works. How quick was that?
1-855-55 Dr. Lou, DRLOU. You give me a call, and then we go from there.
That's so often what it comes down to. You got to come here. Let me get my hands on it. Let me manipulate it. See how it moves.
I would say if it's something that I believe we can deal with, I then need to see it. So I'd say 95% of calls that I get need to end up in an assessment with me. And I think that's just logical. I think everybody understands that. Once we do that assessment, again, then the intervention I often will send to somebody in my team. But we know what it is. It's my opinion. You're getting a lot of people say, is it you that I will see? It's I am the first person that you always see. You'll get my opinion on what I think is going on, along with, if I need to bring in someone in my team that I think is more specialized, we'll come together with and we'll create at least some type of clinical impression or a list of potential diagnoses, and then we're going to treat accordingly. That's how treatment is provided.
Would his 10 to 15-year history make it any different?
Well, it makes it harder for sure. Yeah, it means that this isn't likely going to be a few therapy sessions and you're all better and done. It likely means that this is how do you manage this going forward.
Right. Yeah. And that's it for another week. We'll take it from there. You want to contact, and please do. It would be a smart move. 1-855-55 Dr. Lou, DRLOU, and also info@paincarecanada.com. Till next weekend, Dr. Payne Show, Global News Radio, 640 Toronto.